Hello and welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, man, we're super excited to have you here. You know why? Because we're bringing some really exciting conversations with innovative and transformative leaders that are really painstakingly trying to shape the future of our industry in healthcare. And if it's your first time tuning in, let me just kind of take a step aside, tell you a little bit more about what we're really trying to do here. So we're a healthcare innovation company. We're focused on bringing stories of real people that are in the trenches to life and giving them the platform and the opportunity to share their stories and see hopefully that you'll be able to resonate with them. And as part of our commitment to kind of keeping you updated with the latest and greatest, we're constantly coming up with new content, new interviews. So if you haven't done so already, make sure you hit the subscribe button now, and any new interviews come directly to you to your inbox. We're appreciative of all the comments and subscribes that we've had. So appreciate that. So today I am just really delighted to introduce our next guest, Royce Brunson, the Chief Commercial Officer at GetWell. So Royce he's a maximizer, someone that really knows how to get more out of his team, out of his people, and helping organizations grow. And during his time at GetWell, Royce has played a very important role in developing and implementing growth strategies that have expanded the company's market share and their reach, and also significantly contributed to their accelerating their advancements, especially around sort of their health tech and delivering solutions that are bettering their customers' lives. So his passion for leadership is very, very clear, and it really is embodied in everything that he does, in and out of the professional environment. And previous to his role at GetWell, he was Chief Commercial Officer at Health Recovery Solutions, and under his leadership, get this, top-line revenue saw an astonishing increase of 616% amongst various other impressive feats. And in all of his roles, Royce's leadership skills have gained him a lot of trust with his teams, his board members, senior executives, his customers, making him a vital asset to any organization that he's been a part of. So we're going to be kind of delving into some of these thoughts around leadership and really what does it take to be successful in an emerging, innovative company. So excited to kind of geek out with you today, Royce, and welcome to the show.
Thank you. I loathe the introduction, but I appreciate the accolades.
Why do you loathe it? What goes through your mind when someone's reading some of the things that you've done?
I have played such a small role in those things. It is, from my perspective, like it is so, your role as a leader is to encapsulate all the good things around you. Like very few leaders are really the ones that build it all from the ground up. If you're as blessed as I am, I'm the guy that gets to come in at times when there's winds in the sail, right? And so for me, when I think about all that stuff, like I think about the amazing people I've worked with, and like the list is long. And so yeah, I mean those are the outputs, but like the outputs are the things everybody talks about. I think the thing that we'll probably dive into is the inputs around what it actually takes in a lot of cases. And in my world, a lot of times these are organizations that either need you to build or to turn things around. It's like one or the other, and it takes really great teams to do that stuff. So that's what goes through my mind is like I wish as those are being read, I could like unroll a scroll and be like, all these people do. And so yeah, that's it.
Well, I mean, it's just kind of a testament to your leadership, right? It's not about you, it's about we and what you're doing. So if I was to ask you, I mean, who is Royce Brunson? How would you answer that?
Oh, at work, I would say um, thoughtful. I try to be very thoughtful and empathetic towards the fact that the world that we all live in, especially in the commercial enterprise go-to-market world, is very different than it was 5, 6 years ago. That's for every business. We're asking people to do more. We're asking people to become specialized. It is very much so like in today's world, the death of the generalist. Like we need specialists in a lot of areas. And when we ask incredibly talented people to learn new things, and that's across all functions. We have to be incredibly thoughtful and empathetic about that, the world, the ground that we stand on is changing as we're standing on it. I try to be um, incredibly respectful of the fact that especially in my current role, am walking in with people who stand beside me that have literally 15, 16, 18 years of experience at this organization. There is so much history embodied within so many folks that are here that I try to listen twice as much as I speak in a lot of cases, just to make sure I'm hearing all the different areas. But I think above all else, we are people, and we want to be
Yeah.
treated with an incredible amount of respect and dignity in the roles that we serve. And I always try to bring that. But also, I do not shy away from the fact that I wake up in the morning and do not need coffee to
Mhm.
get going. And so I try to bring the energy wherever I am, however I can do it, and try not to overdo it at times. But yeah, that's within when I
Okay.
might always say my purple jersey on here at GetWell. That's what you'll find, I think, in my role. So, yep.
Awesome. So let's talk a little bit about sort of leadership and how it translates into when you're trying to innovate, especially with in certain environments that are difficult. And I think, with healthcare, people talk about a lot about how there's a lot of healthcare innovation that's there's a desire for it, but who's actually doing it? Can you talk about like crossing that chasm? Can you share a little bit about maybe some of the tips that you have found to be really useful when it comes to taking something that hasn't been done before and then making it the norm?
One of the things I think, and I'll tell the listeners here, I'll tell you one thing Michael didn't do was share any of these questions ahead of time. So, like when we talk about this stuff, it's actually very authentic and real because it's on the fly. But
Yeah.
it's something that we're actually going through now, which is um, innovation and sustained innovation to make it mainstream. Crossing that chasm takes an obsession with the customer and with the end user, and making sure that your product is built for and continues to be refined for what you built it for. And so what we find in a lot of cases is the product lost momentum with this client or in this market because we lost attention to this specific segment of the market or that person. We started to build it for many other people. And so, especially in our world, my world, the commercial and go to market world, it is so important to be fanatical about not serving everybody. And so when we think about a lot of folks who want to look at the world as their oyster, there's this phenomenal article online written by a friend of mine that was a private equity consultant that said the world is not your oyster. And it was all about the fact that strategy actually means a refined approach to the market. And so for me, innovation, you can certainly add, and innovation in today's world is getting harder and harder, right? Because
Yeah.
of many different things. You can certainly add a better feature, a better button, a better this or that than the next person. But what people don't do is have this like critical obsession with who they're actually trying to serve. And so if somebody were to say to me, like, what's the one thing? I wouldn't say it's about the button or the code or this. Yes, that stuff will come, but it's becoming more and more commoditized. It's actually becoming rather obsessed with who you're trying to serve and making sure that what you're putting in market serves that person, those people, or that persona really well.
So when you're going into an opportunity where you're either having to turn something around or let's just call it recalibrated. What goes through your mind, in terms of assessing team to looking at that? Like if your world is 80/20, 'cause it's kind of what you described. You're like the 20% that's driving the 80% of the production. What else is in that 20% pile that's really meaningful to get things to move?
Uh, I am by trade a fundamentalist and tend to think about organizations as you could probably tell who the top performers are in an organization, how they're doing, not only them, but the organization, as well as the trajectory of that by just looking at the fundamentals of the organization in a lot of ways. And so if you know the fundamentals and know how to actually plug those in, and when I talk about that, let's use, for example, this is a really good example. I have a friend of mine who's the chief growth officer at a mid-stage company, 30 to $40 million company. And I went on LinkedIn and I asked him if these two people were their top performers on his sales team. And he said yes. And he asked me how I knew that. And I said, well, just by their LinkedIn, I could tell kind of who's a performer and who's not by these things. And there are some cues and some giveaways with everything that we do in our trades in our lives that tell us if we're really caring or passionate about it. And those things translate, they bleed through with what we do. And so when I go into an organization, I look across the organization, you can begin to tell where the weak spots or the strong spots are, not by the hat tricks and the Hail Marys that are being done, but by the fundamentals that are being done. And I'm a big sports fan. I mean, there's a statistic that less than 8% of Hail Marys are caught.
Yeah.
Right. So like organizations that are actually throwing these Hail Marys of, hey, we're going to go after this new market and we're going to go after this, probability says you're not going to win there, right? But the organizations that are able to build these like really repeatable talent engines and go-to-market engines and commercial engines and product engines and innovation engines, they're actually not focused on the trick plays and the Hail Marys. They're focused on
Yeah.
the fundamentals of their game. And they'll do the fundamentals better than the next person, and they'll be able to repeat it and repeat it and repeat it. And so when we talk about the 20%, the 20% isn't these trick plays by any means. It's
Yeah.
actually like very fundamental things around talent, around commercial elements and product elements of organizations that truthfully are just not practiced very well across many companies.
Interesting. So let's let's translate that into either customers or prospective customers. Do you take that same approach to kind of measure the fundamentals and where there are gaps? Does that same type of thinking apply to when you're approaching customers, working with customers, or future prospective ones?
Yeah, for sure. I mean, here's an example we just had this week was my organization is working with a very large health system on the West Coast. And, they did a bid that we have long since won, but we haven't fully implemented yet. And they said to us, hey, we're thinking about rescoping it from 3,000 beds to 50 to start, just to try it, right? And my guidance is always when we talk about fundamentals is um, there's not a pilot that I've been a part of that has fully scaled. Yeah, it's going 80% of the way or 60% of the way. But what ends up happening is you don't have enough exit velocity if you're a physics fan. You start going, but there's never enough velocity to exit at one point, right? And so when we think about these things, you have to engage with customers in a fundamental way of saying, like, hey, the best organization are actually doing this. And the best aren't the ones at the top of the US News and World Report or anything public. The best customers are the ones that are achieving the best outcomes, right? And are getting the best ROI. This is the template that they're doing. And it's not that. It's actually this. In talking with them in reasonable ways of not building a case of like
Yeah.
a sales case because we've already won the business in that case. It's about
Mhm.
doing what's right by the ROI measures and the investment that they're actually making in the project. So yeah, for us, like it is about, especially for me, it's about like I always say like I'm gonna take my jersey off, my GetWell jersey off for a moment, and I'm just gonna put like a consulting hat on. Like this is how I
Yeah.
would recommend you look at this. And I actually think it helps customers. It breaks down a barrier that's there, a natural barrier of like we're a vendor to we're a partner with them, and I think it does
I hate
help.
the V word. I'm sure you don't like the V word either, but the V
I
word is a very disliked word
Yeah,
in this.
I don't like the V word because a vendor to me is somebody who's in a system. It's like I'm looking at my other monitor. It's somebody who's in my vendor management system, right? Like nobody wants to be managed by a vendor, like nobody wants to be managed by a system. We want to be partners. We want you to throw out those questions, those challenges, and really work with your partner on that. And so, yeah, I think that those are really important things to continue to do.
This is a great sort of on ramp to this next section because and we didn't plan this, so this is great. But you a while back you actually shared a post, and you said two things that make technology successful. And I want to get your sort of reaction to this
I don't
after,
remember this, so
okay.
I'm rehearing it.
So
Yeah, go for it.
two things that make technology successful when deploying it within healthcare. One, tech needs to be launched at scale to create
Okay.
impacts for populations, not a 6 month, 40 patient niche program in one service line. Those implementations never create seismic impacts. And two,
Sure.
healthcare institutions need to adopt technologies that drive clear revenue generation. Has anything
Oh,
shifted from when you posted that, or what other additional context would you want to provide to
if I was sitting getting coffee and somebody leaned over and said it to me, I'd say, "Damn, that guy's right." So
that?
yeah, I mean, but but bottoms up. So on that, so two things. One, um, a lot of too many healthcare technologies rely on soft ROI metrics as the reason that they're staying or being adopted. The days of HCAHPS improvements as being the backbone of adoption are gone. The days of readmission avoidance as being the backbone of adoption are gone. Why? Because those specific technologies can be built in-house through EHR development now. They don't need a third party to do cost avoidance or soft stuff. The days of intentionally built products and programs to drive revenue are here. And so, like, when we talk about intentionally built, um, and I'm an advocate for this. There's no such thing as an intentionally built product by an EHR company that's other than an EHR, right? Other than a documentation
Yeah.
system. They're not. It's just not. So like when we talk about the EHRs were not developed to be intentionally built other than for rev cycle management. And so revenue generating technologies, from what I've seen, 80-90% of them live in third party worlds that have to be intentionally adopted, but they have been intentionally built. So I would stand by that. The first piece of the somewhat cynical 6 month 40 patient pilot, yeah, absolutely. I mean the more niche the pilot, the more it gets labeled as that. So if you start in an orthopedic unit hoping to expand to a med surg unit, you're an orthopedic platform no matter how much you want to not be that, right? And so I think it's really important that two things that the partners orchestrate and outline what a successful pilot looks like, but also what we talked about before, exit velocity. Like you're just not going to have enough exit velocity with 200 patients or 100 patients to make the seismic impact that you want to across an organization, regardless of the hard dollars or soft dollars that are tied to that. There needs to be a true impact that happens across service lines. So yeah, I would stand by both of those things.
Amazing. So, what kind of seismic impacts are you and your GetWell team trying to do this year? What's the main area of focus for you all?
It's a great question. As a business, we have we've set those impact lanes as what we call our win lanes. And so we define, and I would encourage any leader to do this, is to define very clearly your win lanes as a business. Those win lanes should be both quantitative and qualitative in nature. But for us, our win lanes actually tie back to what we call our rally cry. And so our rally cry for Get Well is a 3 word sentence, which is grow with us. And grow with us is intentionally picked verbiage around there being 3 elements of growth. Grow Get Well's growth as a company. And growth for us
Mhm.
isn't just top line revenue. We look at growth a few different ways. That's part of it, but that's one. The second is personal growth. And so we're setting personal growth mantras and missions with each person, and we're funding those. So if it's reading, you're going to have a budget, personal budget for those to buy books, to get training certifications, to get all those things. And the third is professional growth. Well, we have found in our organization that we have not been overly clear on what it takes to have professional growth, right? And so we want to outline that and make sure folks have that and have a clear path for that. So grow with us is our rally cry. We then cascade those into 4 win lanes. For us, I would say publicly, it's winning within our current base, It's establishing our payer market strategy and go-to-market function. We've operated within there for a long time unintentionally. We're now going to make it
Right.
intentional. Um,
Mm-hmm.
we are going to double down on our government opportunity. Our government opportunity has been um, tremendous for us, and we've had a lot of success within that base for quite some time. And for,
Mm-hmm.
as we continue to look outside of our commercial business, our government business is the largest up and comer that we have. And then the last one is
Okay.
about diversification of client base, of pipeline, of a lot of different things. We have um, very specific metrics around what that means for us and what we're hoping to do in terms of diversification. And so those are the things that we're working towards. And I think it's really important that for us and for any business, you have very clear objectives that are not just commercial objectives. If you live within a business that's just waving a sales flag from the top floor and that's your only goal as a company, don't wonder why half, three-quarters of your company is not engaged with the overall mantra. It has to be all encompassing. It has to be about more than just the business and make it personal for folks. So
Does that true north shift year to year? So do you have like a year theme and then it evolves, or do you keep that maybe for a couple of seasons and then you kind of freshen it up? What's the thinking behind that?
So we have reserved the right to change it at the end of the year, but we are also not married to the idea of changing it at the end of the year, and we're going to
Yeah.
play this out. I think, um, we have gone years with it, years without it. Um, what we've noticed is that the years with it have been much more purposeful and meaningful. However, what we've been clear with the leaders who are leading each of these win lanes is that this is in substitution of, not in addition to the day to day, meaning that there needs to be maniacal focus on these. And so that will ultimately mean we may not complete that, new dashboard or that new, feature here or there. I'm making things up, but what I'm saying is
Right,
there
right,
will
right.
be reshifted focus to these different elements because it's what's going to allow our business to ultimately win at what we're trying to do. So yeah.
And kind of looking into the new year, where are you most excited, but at the same time, kind of proceed with caution? There's a lot of noise. There's a lot of
Yeah.
even just confusion amongst what's happening, especially with headlines. How do you kind of unmuddy the waters in that sense?
The thing I'm most excited about internally here at GetWell that we're doing is we in Q3 of last year we launched the first of its kind health equity platform that takes three different programs into one health equity platform, which is social determinants of health screening and navigation, maternal health screening and navigation, and youth mental health screening and navigation. I repeated two words:
Mm.
screening. So we're reaching out, we're screening all these different categories for all these different um, health equity disparities, but we're also navigating. So we put navigators on this as well. And we've partnered with Uber Health and RX Link and a few others to actually drive and close these disparity gaps. And whether you're a payer, a provider, whether you're an employer, this type of platform is truly all encompassing and goes well beyond kind of just the standard what is out there today of like just data collection. It moves to action, which for many of our provider partners and payer partners, they have been really, really excited about. So as the year goes on, that's what I'm going to be excited about. That's where our marketing efforts are, our client efforts are really revolving around helping them close the gaps in care or gaps in disparity that they see in their communities. So
How have they been in terms of, was that something that you all dug up, or was that something that they voiced and then you and the team went back and said, hey, we need to do something about this. We need to kind of really close this
yeah,
gap where,
a little bit of both. We kind of met at second base with it of terms of like we were running one way, they were running the other, and our product lead is a gal named Dr. Chelsea King Arthur, who is she has her PhD in public policy and public health, and knows this space better than anybody I've ever met. And so when we talk about doing things intentionally, I mean, if if there's anyone I would put on like a health equity program and to lead us with that, it'd be Chelsea. And so it was a lot of it of her passion, but also clients coming to us and saying, hey, there are regulatory requirements around this now. The data screams, I need this. If
Right.
anybody follows public health data and looks at maternal health data, it is the single scariest data set you will see. The outcomes for expecting mothers are not getting better. They're actually trending in a really scary direction. So, like this, the funding for this, the need for this, the policy around this, it's all flowing in that direction. And we want to help organizations with that. So, that's what I'm super excited about is that we're there.
Amazing. So switching gears, because you mentioned about sort of going deeper and aligning with your team and making sure that you can kind of fundamentally help them on their journey. I find it fascinating also, and I'm going to pull up another post that you did, which I think is really cool, just because I'm also a dad, and I just kind of want to maybe get your reaction to it, and just give us even more context. But this was a few years back, so I kind of dug deep in here. So being a
Okay.
dad is by far my most important job. When all of our days are packed, we can mistakenly prioritize the hustle of work over what goes on outside the office. Don't do that. Here are three lessons fatherhood has brought to my work. One, balance. The emails, decks, calls, and spreadsheets can all wait. Spend more time getting more baby giggles and less time staring at the screen. You'll remember the giggles, you'll forget the work. Two, tolerance. You will plan, 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 and then boom, it all goes awry. It's okay. Be calm, reset, let's try again. Three, empathy. Be human. Not everyone is always having a great day. Not everyone knows why they're off that day. Just be supportive. And you asked a really nice calibrated question here. Dads, what would you say is the biggest lesson being a dad has brought to your career? And then there's a Father's Day note, but I just figured I'd bring that up because you seem to tie back things to you humanize things. You're not just some commercial leader. You're like, hey, I'm a dad too. I'm a commercial leader. I'm a dad. I can be excellent at work and I can be excellent on the home front. Maybe talk a little bit about what you've done throughout your career to really level out balance, if that is even possible. It seems as though that you're really trying to make that happen.
Yeah, I talk with people and they say, there's that cliche, there's no such thing as balance. You work at home, meaning we all work at home, and most of us do, and so there's no separating. Uh, and I don't buy into any of that. Like I think it's what you want to make it, and I don't want to make it a bleed over world where the stresses and the questions and the pressures of running a $100+ million business bleed into my living room, and that's not who I am. And for me, um, my family or my team knows my family because my office door abuts a busy hallway in my house that my kids run down and fly over my door and they run behind me. And like I don't try to separate it. And at the end of the day, I think that we don't live two lives. We don't have two personalities. We have one life. We have one personality. Like, and those two things come together, inform us. And so we started today's conversation off recording, talking about how yesterday I took my son to pizza for lunch. And like,
Yeah, yeah.
yeah, that means I put a block on my calendar and we go get pizza and that's what we do. And like I'm not looking to change that and to recalibrate on that. And it's funny as a dad of young kids, um, I look back at just the photos I have from like 2 years ago. I'm like, where did time go? I can only imagine somebody who's listening, watching this, and they pull up their phone and they look at photos 20 years ago with their kids, and they're not there anymore. Like, I am not looking to separate those two things. And if someone tells me to, then I probably don't want that juju and that vibe, as the kids would say, around me. And so, no, I stand by all that. And I would encourage anyone who's desperately trying to separate them. The number one way I've learned to separate them, and I'll go back to our first point, is you got to build a good team. You got to build teams where you can work cross functionally. And the people that I found that can't separate them, are taking on too much or unable to delegate, and those things inherently bleed over into life. And so prioritization, delegation, those things really do matter when you're trying to build balance. And so, yeah.
Awesome. So as we kind of close our conversation here, maybe we give a little bit of a commercial, for GetWell, the things that you all are working on, how people can, reach out, get in touch with you. And so the floor is yours.
I did not expect free airtime, but I I will take it, Michael. But no, I think what's interesting about GetWell is we've been in this game 23 years, longer than vast majority of companies have been around times two, type of thing. And GetWell has evolved many times over the years. But what we do in market is we provide a full end-to-end consumer digital engagement platform for enterprise clients. So essentially, large enterprise health systems, payers, et cetera, when they're looking for what is a myriad of different digital health solutions and patient engagement solutions, GetWell has actually built a full platform of over 10 different technologies that sit on one fully integrated, no code, low code platform that can be deployed at scale. And so what's interesting is we find ourselves not competing with one-off partners and vendors in market, but actually competing with the EHR in a lot of ways. And so people will say, we do all this with our EHR. And so we actually find ourselves at the highest end of the food chain within market a lot of times, working with and alongside enterprise clients. But it all comes back to the word of intentionality. These platforms are intentionally built to engage. They are not,
Right.
your patient portal as an engagement tool at 6%
Right.
activation rate. These are intended to engage and drive outcomes. So yeah, that's what we do here at GetWell, and there's a lot of different technologies that are buried within there. So yeah.
Brilliant. Well, we'll make sure we put the link in the description, and we'll make sure we tag you properly here. And for those that have tuned in, if you found this conversation helpful to you, please, would you mind sharing it on social media, liking it, commenting it, maybe even putting in what some of your favorite just golden nuggets that were shared today by Royce, and there were quite a few. So, Royce, pleasure having you on. Looking forward to future conversations. Always welcome to come back and share new stuff that's going on. So good to see you.
Appreciate the friendship, Michael. Thank you.